My name is Akarere Henry. I'm currently the CEO of South Waikato Pacific Island Community Services, a Pacific NGO based in the centre of the North Island. We have been delivering services to the South Waikato of both a clinical and health promotion service since 1999. Certainly the aspirations and the visions of this community and its well-being were put in place or embedded or planted by the many metua that have come and gone within this community that had that dream. And so today our work is about being able to realise them and to continue to flourish as a Pacific community here in the South Waikato. When we talk about partnership, there's partnership that's written on paper, but there's also the partnership that allows us a one-to-one, face-to-face, and a real organic approach to how we develop relationships. And that's certainly been evident from the framework that Healthier Lives has been able to accord us in the relationship that we've developed with Auckland University, and being able to co-design, pilot and trial, and depending on its evaluation and outcomes at the end of this process will enable us to be able to one, deliver it across the country, but more importantly, have a tangible tool that supports Pacific wellbeing. Certainly in a rural context is the whole issue of access. And access can be described in many ways. It could be as simply as knowing that when you walked out your front door that you had 5 various transport options, which we don't have here. So the co-design process was able to embrace all of those elements so that we never lost who we were, but were able to grow and develop under a model that allowed us to determine what well-being looks like for us. I mean, we began a process here that says, what are our dreams and our aspirations for our community? What does good well-being look like? And really just to unpack all of that, I think has been an invaluable tool that we've also been able to incorporate across the organisation and community as a standard process of how to engage. The world is moving to a virtual space. We needed to have the development of a tool that could practically serve and support this community. And thus far, I believe there's been sufficient evidence of its success and its ongoing sustainability that will allow us to be able to celebrate what I know will be some positive outcomes for our community. There is us at the coalface, but we're not naive to know that there is a bigger landscape, and for us to be able to harness opportunities for our community, we need to be in a space that allows us to advocate, negotiate on an even playing field. So what will support us is that kind of evidence and data and literature that says exactly what we know. I believe the biggest single challenge that is facing Pasifika Health is trying to align itself or conform itself to a very mainstream model that is not inclusive or recognises or acknowledges the cultural ethnic makeup, the protocols, our practices, the things that we hold dear to us. What we're needing is to have a system that is embracing of those nuances but similarities across all cultures. Really like to recommend that those that are charged with having a big blue sky view, that sometimes it simply is recognising the cultural identity and makeup of the people that they serve. Currently though, what Healthier Lives has done has recognised the need to be incorporating and embracing the various rurality challenges, the ethnic makeup challenges, and this tool that has been developed, this mHealth tool, has clearly shown that desire of the National Health Challenge to begin the conversations on how that could look